Well, we are delighted and honored to have with us today Peter Berns. He is the CEO of the Arc of the United States, and he is going to give us some context on the federal side, what is happening in Washington, D.C., and there is a whole lot happening. Hello, Peter. I'm going to quickly introduce you and then hand it over to you. And everyone, there might be a lot of questions on this one because it seems like there is, every day there's something new and very important for our community coming out of Washington, D.C. I think Peter has updated his presentation like 5 times in the last week, probably. And so I'm going to introduce him. So put in your Q&A, and we'll make sure to get to some of those. Peter has been at the helm of the ARC since July 2008, strategically managing a national organization with 600 state and local chapters across the country. Under his leadership, the nearly 70-year-old organization has charted an ambitious course of progress, innovation, and change as it aims to achieve its mission of promoting and protecting the human rights of people with intellectual and developmental disabilities and actively supporting their full inclusion and participation in the community throughout their lifetimes. I'm thrilled to introduce my friend and colleague, Peter Berns. Welcome, Peter. I'm handing it over to you.
Great, thanks, Jordan. Just give me a thumbs up, everybody can hear. Great. So it's really good to be here. Thank you for that introduction. I'm really looking forward to when we can be together again in person. I'm going to actually start without slides, and about halfway through the presentation, I'll share my screen and bring some slides in. So I've got a lot to share with you in 30 minutes. I'm going to jump right in. But before I do that, I do want to wish you well on behalf of the ARC's National Board of Directors and our staff. We want to wish you well and really share our hope that you've been doing as well as can be expected in this strange year that we've had, these challenging times that we're living in. First order of business, we just scored a really big victory, and I want to thank you for all your advocacy, which is what made it happen. Just last week, the United States Congress passed and the President signed into law the American Rescue Plan. This new law, which is actually the sixth COVID relief bill, finally addressed the needs of people with intellectual and developmental disabilities, their families, chapters of the ARC, and other provider agencies, and the direct support workforce. And it took all of us advocating together to members of Congress over a year, but together we just scored a big victory. We won $12.5 billion in additional funding for Medicaid, home and community-based services. And the estimates are that about $2.2 billion of that new funding will be coming to you in California. The bill also includes $1,400 stimulus payments. They're now called recovery rebates. And this time, adult dependents with disabilities are eligible to receive this cash assistance. The bill extends the tax credits for businesses, including nonprofits, that provide paid leave to employees who need to take COVID-related leave to care for family members who don't have care available or out of school or who become ill themselves. There's $130 billion for state and local school districts, including $2.6 billion for K-12 IDEA funding, $200 million for preschool IDEA funding, and $250 million for early intervention services for infants and toddlers. And it's estimated that California will receive about $267 million of that IDEA funding. The bill also includes more than $40 billion in housing assistance to keep people from losing their apartments or their homes and keep people from becoming homeless. There is more than $39 billion to support childcare. And there's $350 billion to support state and local governments, which will help keep services for people with disabilities off the chopping block for budget cuts, as they so often are when state governments have budget problems. And a lot of the state governments around the country have budget problems as a result of COVID. And last but not least, the bill dramatically expands the child care tax credit, the earned income tax credit, both of which are really important to low-income households that have a family member with disabilities, and they're also important to the direct support workforce. And there's a lot more in the bill, but those are just some of the highlights. So this is a really big victory, and it only happened because of very vocal and persistent advocacy by people with disabilities, their families, chapters of the ARC, and other provider agencies and direct support workers. Over the past year, you worked tirelessly to fight for the critical needs of people with intellectual and developmental disabilities to make sure that their needs were included in the COVID-19 relief legislation, contacting members of Congress more than 170,000 times. To support this advocacy, our team has aggressively sought out media coverage to shine a light on how the pandemic is impacting people with intellectual and developmental disabilities and their families, our chapters and other provider agencies and direct support workers. And we've had great success. Perhaps you saw the Families from the ARC featured in 2 different segments of the Today Show over the past year, exploring the impact of COVID on students with disabilities and adults with disabilities living in group homes. All told, over the past year, we've had more than 400 national news stories on television, radio, print, with major news outlets ranging from the New York Times to the Washington Post, National Public Radio, Times, CNN, MSNBC, PBS, the Wall Street Journal, Forbes, and more. And that's not including all the local coverage that you generated, and it's not including all the coverage we generated together on social media. So it was a really impressive organizing and advocacy effort, and it worked. Now, legislative advocacy, of course, is not the only means that we as a community to use to promote and protect the human rights of people with intellectual and developmental disabilities. And much of the past year has also been focused on legal advocacy. On the legal front, we've been fighting to prevent discrimination against people with intellectual and developmental disabilities in healthcare related to COVID. We want to make sure that no one was denied a ventilator or treatment or put lower on the list for treatment because of their disability. We wanted to make sure, we've fought to make sure that hospital visitation policies accommodate the needs of people with disabilities appropriately, and that they also have access to testing. And more recently, we've been working to make sure that people with disabilities, their family caregivers, and direct support staff have access to vaccines. Over the past months, we've filed complaints with the Office of Civil Rights of the U.S. Department of Health and Human Services, challenging crisis standards of care plans, visitation policies, and vaccine plans in 13 different states. And we've been able to attain a number of good results with policies and practices changed. So together as the ARC, we organize the disability community to achieve a major new investments in programs, services, and supports for people with disabilities and their families, billions and billions of dollars. Now what we need to do moving forward is to make sure that these investments and services become permanent. So I also want to share with you some really important news from just Tuesday of this week about the campaign we're gearing up for next. Just this week, 4 members of Congress in the House and the Senate released a discussion draft of a new piece of legislation a new bill that we've worked with them over the past year. And if it becomes law, it will make Medicaid home and community-based services available for all people with intellectual and developmental disabilities who need them. It's called the Home and Community-Based Services Act, and it will make home and community-based services a mandatory service under Medicaid rather than it being an optional waiver service as it is most places around the country. It will create parity among states so that the same services are available from one state to the next. It will also make home and community-based services portable from one state to another so people can move to be closer to loved ones or just because they want to live somewhere else. And they won't have to go to the end of a long waiting list to get services. And it will also address the direct support workforce crisis and do a lot more. So we've got to all get to work and make sure that this happens, that this new bill is passed. And it starts by your sharing. There's a discussion draft, and the members of Congress are inviting all of us to weigh in and share our ideas. And then once the bill is introduced, then we're going to all need to work very hard to get it passed. So I'm going to pause there for a second, and I understand there's a need to share a continuing education code. Chip or Jordan, I'll invite you to do that now. And while you're doing that, I'm going to get my slide deck up.
Thank you very much, Mr. Berns. This session is being co-sponsored by the Golden State Pool Trust and is eligible for the minimum continuing legal education credit. The MCLE credit is approved by the State Bar of California and the North Bay Housing Coalition. To receive credit, you will need to write down the following code, 1125. Again, that code is 1125. That is the code you will fill out on your form and return to amy@gspt.org along with your daily survey. Again, that code is 1125, and back to you, Peter.
Great, thank you. So you should be able to see my screen now. I should be able to see whether you're seeing my screen now, but I've got the heads up. Can someone give me a heads up? Okay, let me see where, sorry, I need to get my notes back up here. So, as all of this has been going on, these new legislative developments, the success with the American Rescue Plan, the new HCBS Access Act being introduced, we have at the same time, been very busy planning for the future. In fact, the ARC was in the midst of doing some long-range planning for the future of the organization at the time COVID hit. And I'm really excited to share with you our new strategic plan. We call it the Strategic Framework for the Future of the ARC. And I'd also like to share with you some of the research that was involved in creating this plan, some things that we learned along the way that I think you'll be really interested in. And one thing I want to make clear is, this is really your plan. This is a plan that was developed with extensive input from across the disability community and particularly within the ARC network. Literally thousands of stakeholders participated in this process. It was a process that was led by a 24-member planning committee we had at the ARC. More than 4,000 people participated in the stakeholder survey, and I'm going to share some of the results from the survey with you. We interviewed more than 60 leaders from the disability community, the business community, the foundation community, other civil rights organizations, and had meeting after meeting after meeting, large group meetings, small group meetings, online, in person, you name it, all for purposes of developing this plan. The plan was adopted against the backdrop of the ARC's mission, And the mission hasn't changed, and that is to promote and protect the human rights of people with intellectual and developmental disabilities and actively support their full inclusion and participation in the community throughout their lifetimes. What is new, though, is the vision. The vision is how we think about what the world will look like when we achieve our mission. And we've stated that in a way that we think is simple and that everyone can embrace. And that is, the ARC's vision is for people with intellectual and developmental disabilities to be valued members of their communities with the opportunity to realize their full potential and a future that is secure. And we think this is a vision that is really straightforward and understandable, that it can be easily embraced by self-advocates, by parents, by siblings, by professionals and supporters, and that it communicates a lot in one short sentence. When I think of the vision, I think about William Washington, our receptionist at the national office, who is a resident of the District of Columbia, fully involved in his community, living the life he wants, and he has plans for the future. And perhaps some of you have met William over the years at the annual convention. We found that everybody's been really excited about this vision. And after reviewing all the input we received, we came up with 4 goals that we think express and represent the collective wisdom of our stakeholders. And the idea of goals in a strategic plan is that we work to achieve the goals. And if we're successful, the vision becomes a reality. So I'd like to share them with you. The 4 goals. The first is that every member of society recognize and respect the human dignity of people with intellectual and developmental disabilities. The second is for people with intellectual and developmental disabilities to be masters of their own lives and destinies with help from family, friends, and other supporters if needed. The third goal is for people with intellectual and developmental disabilities and their families to have access to the quality supports and services they need and want to achieve a life of personal significance. And the fourth and final goal is for the ARC to be an even stronger, more diverse force for change, capable of wielding power with and on behalf of people with intellectual and developmental disabilities and their families at the local, the state, and the national level. We were very excited when we put these goals out for comment in the course of the process, because they were really embraced by our constituents. And we weren't, frankly, surprised about that, because as I suggested earlier, the ideas for this plan came straight out of the results of our national stakeholder survey. If you take goal 1, for example, and I think I've just misplaced the slide here. Well, if you take goal 1, I think I've lost the slide. You take goal 1, for example, we heard repeatedly in interviews and in meetings, and goal 1 is the goal that every member of society recognize and respect the human dignity of people with intellectual and developmental disabilities. We heard repeatedly in interviews and in meetings that among the general public, there's a lack of respect for the humanity of people who have an intellectual or developmental disability. And our stakeholder survey really bore that out, with nearly 9 out of 10 of people who responded to the survey agreed or strongly agreed with that statement. We are not going to have time today to go into all the details of the stakeholder survey, but I do want to point out that a summary of the results of the survey is available on the ARC's national website. But we would like to tell you more about the strategies. And strategies are, these objectives that we pursue that, if we're successful, will help us achieve the goals. And the goals, I said, are what get us closer and closer to achieving the vision. The strategic framework has 5 strategies, and I'm going to review them now and also share some other observations with you. And the first strategy is to build the movement. The ARC will organize and mobilize a more powerful movement of people with intellectual and developmental disabilities, their family members and supporters to be activists for change. And this strategy was really driven by our stakeholders. In our national stakeholder survey, and you can see this on the next slide, 85% of the survey participants stated that it was important to them to be part of a nationwide movement dedicated to people with intellectual and developmental disabilities. And one of the things that was interesting about this is this interest in being part of a nationwide movement. You know, it was particularly strong among those who were familiar with the ARC. But we also had folks who were less familiar with the ARC who also expressed that they were very interested, that it would be somewhat high, medium, or highly important to them to be part of a nationwide movement dedicated to people with intellectual and developmental disabilities. The second strategy in the plan is to speak truth to anyone who will listen and those who will not. The ARC will work with people with intellectual and developmental disabilities and their families to amplify their stories, call for recognition of their human dignity and the day-to-day challenges they face, affirm their abilities and contributions, and demand change. Let's skip that one. The third strategy is to advocate. The ARC will aggressively advance the interests of people with intellectual and developmental disabilities and their families before the executive and legislative branches of government and in the courts, and influence the practices of other private and public sector organizations. The fourth strategy is to extend our reach. The ARC will expand and sustain our presence as a critical part of the fabric of every community where people with intellectual and developmental disabilities live. And when we talk about extending our reach, the obvious question is, well, extend it where and how? One of the things the stakeholder survey helped us answer that question. What we saw in the stakeholder survey was clear direction that we should cultivate and strengthen our partnerships with business organizations and individual companies, with other marginalized communities, with other civil rights groups, and with religious organizations. And one thing that was a little curious about these findings I'd like to point out is that it's a bit perplexing that the interest in extending our reach to these other communities was less pronounced among those who are already familiar with the ARC than among those who are not. I'm not quite sure what to make of that finding, so I'd really appreciate any thoughts you want to share on that. As for the business community, our stakeholders were pretty clear that they want to see businesses do more. They want businesses to do more employing people with disabilities. They want businesses to do more supporting employees who are caregivers. And they also want to see businesses do more to develop products and services to support community living. Last but not least, the fifth strategy is to innovate. The ARC will capitalize on the collective knowledge and creativity of our Federation of Chapters to envision, pilot, and implement new and improved programs, supports, and services, and to create new opportunities for people with intellectual and developmental disabilities and their families that they need and want. So the idea, again, with these strategies is we implement the strategies that helps us to achieve our goals and draws us closer and closer to making the vision a reality. Now, I don't have time today to get into the next level of detail in the plan, which are the tactics. And for each of the strategies, there are specific tactics that are in the plan. You can see those on our website. There are 43 in total. But there are a couple themes in the tactics I want to mention, two in particular. The first is you'll see a lot of reference to reaching out to and engaging diverse communities and bringing intersectionality into our work. And by that, we mean that we need to learn more about how disability is experienced by those who are also part of other marginalized communities, such as racial, ethnic, and religious minorities, the LGBTQ plus community, and others, and to factor that knowledge into our work. And second, you'll see an emphasis on the ARCS chapter network and the central role that it plays in everything that we do. So in closing, I'm going to ask you, won't you work with us? I'm sure you will. Won't you work with us to build a more powerful disability community movement? We're on the cutting edge of achieving the next major milestone in disability rights, the beginning of a new era where there are no barriers to home and community-based services, where our vision of people with intellectual and developmental disabilities as valued members of their communities with the opportunity to achieve their full potential and a future that is secure, where that vision can become a reality once and for all. So thank you very much for having me today, and look forward to working with you this year and in the years to come. And again, hope to be with you in person at your policy conference next year.
Peter, thank you so much for all the information. Again, as you mentioned, things are changing quickly, and what you kicked off with, just the incredible win and victory for our community in the latest stimulus package. We have just a couple questions, and we have a couple minutes and time to do that, if that's all right with you. One question is
Absolutely.
One question is on the HCBS. It's a 10% FMAP increase, which is a 10% increase to the share that the federal government will give to the state of California, which means that we're calculating that exactly to, I can answer a little bit of that. It's hundreds of millions of dollars for our developmental services system, for our regional center system. For 1 year, we get a bump of exactly how many hundreds of millions of dollars we're trying to figure out. And I don't know if the question is, will it impact rates? Well, it depends on how the state decides to spend it. We're going to talk about that in the next session, so stay tuned on that. Peter, I don't know if you wanted to add anything about the HCBS bump that was in this. A great, huge victory.
The estimate is something like 2.2 billion flowing into California for HCBS.
Yeah.
And it is up to each state to figure out how to spend that money. But very important part of the bill is the state can't use that money to replace money it's already spending. It has to add.
That's a very important part, and you and your team were critical in making this happen. So we in California are receiving an enormous gift here from the efforts that all of you may have been part of in sending letters to our members in Congress. And so we'll be talking a little bit about that in just the next session. One more question about rules on SSI and administrative judges, administrative rules. I know SSI can often be a complicated mess for everybody. I didn't know if you had any insight or thoughts on new administration, any changes that might be coming, or anything else.
I'm afraid I can't share any, don't know enough in depth to share specifics there. I know that there were a number of issues that were arising under the prior administration that were going to make it more difficult for people to get SSI and keep SSI. And a lot of that, fortunately, we were able to delay long enough in the past administration, and the new administrations put a hold on a lot of that. So a lot of the bad proposals that would make life even more challenging for folks applying for SSI, on SSI or on Social Security disability, have now been stopped.
Appreciate that. Peter, thank you so much for joining us today. Really appreciate it. Your information is always insightful and timely, so thanks a bunch for being with us here in California.
Thank you so much for having me, and have a great rest of your conference.
Thank you.